Hi, my name is Nicole Benitez, and my research critique was done on a study entitled The Effects of Music Therapy on Anxiety of Patients with Breast Cancer After Radical Mastectomy, a randomized clinical trial. The research problem was introduced that breast cancer is among the most common cancers in women worldwide. Breast cancer may also cause severe psychological disorders, anxiety being the most commonly reported by patients with breast cancer. Music therapy has been shown to have a decrease on anxiety in patients with cancer, but there is little information or research available on the effects of music therapy related to breast cancer patients after a radical mastectomy. The current literature suggests that there is a global increase in incidence rate of breast cancer worldwide, and that the rates in places like China and other countries where the incidence had previously been low is now on the increase. Cancer treatments like surgery and chemotherapy have been shown to be aggressive and leading to an increase in side effects, and stress and anxiety being one of the most reported common side effects. Others include fatigue, sleeping difficulties, increase in heart rate, digestive problems, sleeping problems. The music therapy now has been shown to decrease the anxiety in patients with cancer, but again, there's little information on regard to specific cancers like breast cancer or after specific treatment like a radical mastectomy. The study framework used was the Lydia E. Hall's Core, Care, and Cure model. Patients following radical mastectomy would be in the second stage of her model. She split the stages into two, the first stage being acute and the second stage being non-acute. The non-acute is likely to be the recovery phase, which is most conducive to learning and effective for treatments. The core represents the patient in this study. The care part represents the intimate bodily care, and then the cure part represents the nursing behaviors, such as medication or treatments. There is a flow chart here to show you the concept model related to this study. The research design was a randomized controlled clinical trial of female breast cancer patients. The intervention would be the music therapy that was offered to the experimental group, coupled with routine nursing care. The independent variable would be, again, the music therapy that was offered to the experimental group versus the control group. And then the dependent variables for the study were the state of anxiety score that they used to determine the state of anxiety for the control group and the experimental group following their radical mastectomy and their chemotherapy treatments. There was no blinding used in the study. There were two research hypotheses that were developed for the study. The first one being that patients in the experimental group will have a reduction in their state of anxiety scores after their music therapy. And the second was that there was the treatment effect changes the follow-up time, meaning there's an interaction effect between the treatment group and the follow-up time. The aim of the study was to examine the effects of the music therapy on patients after their radical mastectomy in a Chinese setting. The sample was made from an oncology center of a general hospital in China, and the convenient sample was made up of breast cancer patients admitted to the hospital. The inclusion criteria would be ages 25 to 65 with a pathological diagnosis of breast cancer requiring a radical mastectomy. Exclusion criteria would be an allergy to sound, anyone with a voice sensitivity to epilepsy, and anyone who did not prefer to listen to music, as that would create a bias in the study. The sample size was made of 120 breast cancer patients, and the number of 120 came from the fact that in order to determine the differences of the 5-state anxiety score, they would need at least 100 patients. And they opted to increase the total to 120 to accommodate for at least a 20% dropout rate in the event that that would happen. So they would still have accurate results. The numbers were randomized by numbers and then produced from a computer and allocated into two separate groups, the control group of 60 patients and the experimental group who would receive the music therapy of 60 patients. The data collection analysis, so the standardized demographical questionnaire was used to gather demographical information such as occupation, age, education level, and residency, monthly income. That was given to both groups prior to their radical mastectomy. And then they use the State of Anxiety Inventory Scale. That is a 20-item scale to assess anxiety. It comes with a score range of 20 to 80. The higher the score, the increased incidence of anxiety or the severity of the anxiety. And then it was done as a pre-test first, before the radical mastectomy, and then 3 post-tests. The first post-test being done after their mastectomy and right before they were discharged, and then each post-test after was done during their chemotherapy treatments. The data was entered into a database established using the EPI data version 3.1, and that developed frequencies and percentages, means, and standard deviations. The frequencies and percentages were summarizing and categorical variables, and the mean and standard deviation summarized continuous variables. The t-test and chi-squared and the ANCOVA model were also used as well. The t-test and chi-squared were to determine differences between the baseline data of the groups, and then the ANCOVA was a repeated measurement model used for the data analysis with treatment. The interventions we used in the experimental group, the music therapy that was developed from the patient's choice of listening, that was made with a music library downloaded onto an MP3 player. The therapy was delivered by the researchers twice a day for 30 minutes, once in the very early morning and once in the evening. The control group only took part in the pre and post test, and they got no information about the music therapy, and they only received general nursing care instead of the music therapy and the general nursing care. The music library was made by the researchers and ranges from classical folk music to famous world music. With ethical consideration, the study was reviewed by the appropriate human resources for Human Research Ethics Committee. All participants received an explanation of the study and provided written consent for voluntary precipitation. Total dropout rate was 15 participants leaving the study, and the final count was left at 105 participants. The control group had 51, and the experimental group had 54 patients. With the demographics, there was no significant differences between the control and the experimental group. Most age ranges between 40 and 45. They were married with 1 child. They lived in a city. They had a high school education, had moderate income, and had a modified radical mastectomy. The state of anxiety score pre-test, there was 93 with moderate level anxiety and 18 with severe level anxiety. There was no significant differences between the 2 groups on the pre-test. Now, the post-test scores showed that the mean SAI scores of the experimental group were significantly higher following the music therapy rather than the control group after the 3rd post-test. Findings also supported both hypotheses to be true, and they were consistent with all other research done on music therapy related to cancer patients. The limitations of the study would be that the data was self-reported, influenced by emotions, misrepresentations, and defensiveness. There was a need for further study on the fact that the subjective experiences of the effects of music weren't necessarily studied, and that there was no psychological or physiological variables, so that the effects physically after music therapy should be further studied as well. The control group only received routine nursing care, so there was a chance that maybe altering the care that they got would have made a difference as well. And furthering the effectiveness, there needs to be a study done on the time and methods for the music therapy. Maybe altering that would be a difference in results as well. There was only a small part of the sample that received an extensive radical mastectomy, and that actually could make a difference on the results as well if they studied specifically people who received extensive radical mastectomy. Cultural differences wasn't something that was mentioned, but because the study was based specifically on Chinese culture, I believe that cultural studies could also be a limitation of this study. As far as implications for nursing go, music therapy was found to have a positive effect on reducing anxiety. So reducing the anxiety in patients could also lead to be utilized in a different way for improving anxiety. It could lead to patients' increase in well-being and satisfaction. It could also be generalized to clinical practice to benefit a larger group of people. Under the CARE, CORE, and CURE model, music therapy can be used in accordance with nursing practice to help further reduce anxiety in patients with breast cancer. Thank you so much for listening, and that was the end.